I don't often go on national television and suggest that Tory ministers are intoxicated with illicit substances, but after the NHS Secretary Steve Barclay suggested the NHS didn't need any more cash, I actually thought that was a more generous explanation.
I mean, the fact Steve Barclay says he doesn't need more money, is the Health Secretary high? I'm sorry to be so rude and so blunt about it, but when you have millions of people on waiting lists, when you have a lack of staff to do key roles, and you have an ever-growing ageing population putting greater pressure on the NHS, unless you put more money and resources in the NHS, I'm just to be very straightforward about this, people are going to die. People whose lives would be longer than they were are going to be diminished. People won't be treated for mental health services. The biggest killer of men under 45 in Britain is suicide. But if you're in crisis, talk to people in a mental health crisis. Talk to people who've tried to take their lives in this country. They get stuck on a waiting list for months or shunted halfway across the country. This is a crisis. It needs cash.
But if you look, we are on our way to spending 40% of our tax take on the NHS, which is in many ways as it should be because the NHS's need is so big, but it's unsustainable. And I know that you won't say we need to have more private, not less private, but I can't see any other way of getting the money into the NHS without bankrupting the whole system. So if we were able to do more partnerships with the private or some sort of insurance system, like national insurance system, like they have on the continent, at least then you would be getting extra money for the NHS where it's
not
needed.
true. Look, for example, the private finance initiative, which New Labour massively expanded in the 2000s, what that idea was, basically, was we'll use private finance to come up with these nice, big, shiny new hospitals. That seemed like a great idea in theory, well, except to those who saw what the problem was, except what that did is lumber health services with massive 30-year debts, which led to some of them on the verge of bankruptcy. It was like paying...
No, that's true. That's absolutely true.
It was like paying for public services on a credit card.
Yeah.
The problem with private companies is what they want, what they're driven by, is profit. That's how capitalism works. So if you introduce more private sector involvement in the NHS, they will demand taxpayers' money that could go on nurses' pay, on new beds, will end up going to dividends to shareholders. Of course that doesn't help the NHS.
Now, the scale of the crisis that has enveloped our National Health Service really does have to be spelled out to be believed. So back in 2010, before the Tories came to power and wrecked the country, there were 2.5 million people on waiting lists in NHS England. 2.5 million. It's now over 7 million. Now, around 10% of the workforce is missing. We're talking about vacancies that need to be filled. That's around 400,000 nurse vacancies, tens of thousands of others as well. The number of GPs in permanent roles between 2016 and 2021 fell by 6.5%. Morale is at rock bottom, with surveys suggesting that about half of NHS staff are considering leaving. When you take into account the growing workload that's imposed upon them, but the fact they've suffered real terms pay cuts, that you have nurses in this country going to food banks, is it really shocking that about half the workforce is considering just exiting and finding something else to do with their lives? Now, there's a record number of people, of patients, having to wait at least 4 hours in accident and emergency. That's more than 30% of patients. But if you look at those who've waited more than 12 hours, which is absolutely ludicrous, by the way, it's more than 44,000 people. Ambulance waiting times have soared as well. Let's just be clear. The NHS, as we understand it, is falling to pieces. The idea it doesn't need more money is unhinged. When people say, oh, we need to reorganise it and all the rest of it, we keep getting reorganisations. Andrew Lansley's reorganisation, so-called, of the NHS, which opened it up further to privatisation, to marketisation, was 3 times bigger, the legislation, than the original legislation that actually founded the NHS in the first place. All it is waste money, it's hugely expensive, and cause chaos across the NHS. Now, whatever my criticisms of New Labour, we don't want the video to go on for 10 hours, they did invest money in the NHS, which brought waiting lists down. And even though it was undermined by privatisation and marketisation, people's NHS care improved. Now, when people say, well, cash doesn't solve everything, no one claims it does. But obviously, when we have an ageing population, that is people with medical needs, that number is always growing because people are living longer. as well as the fact we've had to deal with the COVID emergency, obviously that means we need more resources, and resources cost money. We need more trained nurses and doctors. We need to keep the nurses and doctors that we've got, and all the other crucial NHS staff for that matter. We need more beds. We need more medical equipment. These are all things that we desperately need, but that needs money. And for the Tories to try and deflect responsibility and make it out as though it's the NHS's own internal failings, it's a problem with the system, which they only ever say because they want to pave the way for more privatisation, is a ludicrous attempt to deflect from their responsibilities that they won't fund the NHS because it would mean taxing their rich donors more. They're ideologically opposed to that and opposed to it because that's the people they exist to represent in politics. Please like, subscribe. I'll see you next time.